this video, let us look at obscure autopsy. Basically, here they are saying that there is an autopsy done, and even after detailed postmortem examination, the cause of death cannot be detected. Okay, so then what they will do? They will do some clinical examination, more detailed, and then lab investigation and even pathological examinations can be done. Then you can get some answer. Okay, so so basically here, what they are saying is, what will you do in lab investigations? You would have taken the blood, urine samples, the stomach content and all that, right? So you can find out. Pathologically, you can do some dissection, the coronary system, the arteries, the pulmonary arteries, the brain, carotid arteries. These specimens are taken for histopathology, especially the heart, okay? And you can also use some special stains like phosphotungstic acid, hematoxylin, dehydrogenase enzyme, histochemistry, etc. Acridine orange, fluorescent stains can be used. Okay. So basically, you can try to find the cause of death. Now they are saying, why can this happen? Obscure autopsy, why it can happen? So basically, usually 20% of postmortems, it can remain obscure. You don't know why it happened. And usually in young people, why a young person died, right? So that becomes a question mark. So what are the causes? They are saying the causes will be like, so we'll come to the causes, but remember, finally, even after doing all this, if you don't get to know the cause of death, then it becomes negative. Obscure is after autopsy, if something happens, you are not able to find it, that's obscure autopsy. But you can still do lab investigations, pathology, etc. and you can try to find the cause. Negative autopsy is even after doing everything, you're not getting anything. That is negative autopsy. Now look at the causes for an obscure autopsy. Natural diseases like emotion, stress, death with functional failure, epilepsy, paroxysmal fibrillation, biochemical disturbances like uremia, diabetes, electrolyte imbalance, respiratory pigment disorders, endocrine dysfunctions like adrenal insufficiency, thyrotoxicosis, mixed edema, concealed trauma like some concussion, self-induced neck injury, blunt injury to the heart, vagal inhibition, reflex vagal inhibition, poisoning without microscopic changes, like some poisons like anesthetic overdose, maladministration of anesthesia, neurotoxic, cytotoxic poisons, plant poisons, narcotic poisoning. Then miscellaneous, the person can die because of allergy, drugs, idiosyncrasy. Okay, so these are the causes. So basically, after all these pathological and clinical and lab investigations and all, you cannot find anything, then it becomes negative autopsy. Okay, so what is the medico-legal importance? About 20% of cases will be obscure. So it's a major confusion for any forensic expert. Usually in young age groups it can happen. Okay, that's all for now in obscure autopsy. Bye-bye.